Welcome to Better PR, a podcast by PRSA Sierra Nevada. Today we're here with Kathie Taylor, APR.
Hi, everybody. I'm Kathie Taylor. I am the Chief Marketing Officer for In Plain Sight Marketing in Carson City, Nevada, and I am the VP of Professional Development for the PRSA Sierra Nevada chapter.
And we're also here with Dan Davis.
Yes, Dan Davis, the Public Information Officer with the Carson City School District and former board member of PRSA Sierra Nevada chapter.
So we had you on for a previous episode, but we just found out that you were a part of a team for the Reno Air Races crash. And we wanted to have you back on just to talk specifically about how to deal with a situation like that from a public relations perspective and, maybe your role in it and anything that the public may not have gotten from the public-facing avenue of the campaign.
Great. Yeah. This goes back, I think, to 2012 is when the crash occurred. I was the public information officer for Renown Health at the time, which was the primary hospital. It was a trauma center based out of Reno. And so we took a total of, I think it was 62 patients in under 60 minutes. And so I know our first responders dedicated a travel lane from Reno to Stead to support the influx of patients through ambulance as well as care flight and stuff. So we did a successful job in triaging that number of patients in that amount of time.
So being that it was so many years ago, could you just give us a little bit of a recap of what happened?
Actually, I'd love to. The way our emergency or crisis communications plan worked at the hospital is, there's a number of assignments that were delegated to various members of our communication team. And we actually had the opportunity to practice that real life scenarios twice prior to the Air Races crash. There was one incident with a train crash that happened with a semi-truck outside of Fallon, Nevada. And we called a code triage, which is basically stresses the hospital in where we have to gather additional resources to meet the needs of that particular case. And one of those resources is communications. And so the PIO and a number of other individuals were called in to manage the news media, internal communications with employees and doctors and surgeons and that sort of thing, as well as any external communications with our followers and various people. So that occurred, and we were able to manage that. There was another case where there was a shooting in Carson City at the IHOP restaurant, and we were able to function with our crisis communication plan at that time. So we were well versed in duties and responsibilities, who was managing the news media, who was managing internal communications, who was managing the website and doing updates on social media. And so our team was pretty well rehearsed prior to the Reno Air Races crash that happened. I think it was in September of 2012. I can't recall the numbers or the dates accurately, but I know it was on a Friday afternoon, right when everybody was getting ready to go home, and we got called into the emergency room, and I was walking down the hall, and I saw a number of gurneys lined up, and on each bed there was a number, and I was like reading them as we were walking to our command center, and 32, 33, 34, and the numbers kept going up, and I'm like, this is going to be a big event. I know that. And so we went in and went to work. And I think just looking at the information that I had, an estimated 200 local, national, international media inquiries were received and responded to within the first 24 hours. And I was on the phone with international news, consulates from Sweden, CNN, ABC, all the main news stations, and they were trying to line things up to cover it the next day. Within 4 hours, I think our switchboard at the hospital received close to 2,000 calls, and those were dedicated and dealt with appropriately. You know, just family members trying to find their loved ones or various things. So, and I know within 20 minutes there was the Family Assistance Center that was opened, and you know, counselors, chaplains, social workers were all there to assist. So there's a lot of good things that we were able to accomplish, and a lot of that is just based on the previous success in managing our communications and working through our crisis communications plan. So,
can you tell us, Dan, walk us through some of the key essential components of a successful crisis communications plan? How do you start, and what are the things that you really need to include?
I think in this particular case, in something this big, you have to delegate. You have to have somebody to manage the phone calls, to manage, you know, taking the incoming calls and taking down names, numbers, and calling them back with information as you have it readily available. You need to dedicate somebody to doing the stand-up live interviews, because we had news crews there within 15 minutes of the crash that were outside the hospital. We had to have somebody there giving updates every 15, 20 minutes to those news crews. You have to have somebody dedicated to social media. And this was still fairly new back when social media was still coming alive. I think businesses at that time were just opening accounts. And so it was a new thing to manage business accounts on Facebook and Twitter and all of that. So having somebody who's educated and familiar with those platforms to be able to monitor what's being said. I mean, when we were sitting in the command center, we were watching video footage of the crash that was captured from, you know, people's phones that were there in the grandstands at the air races. So we were getting information from social media sites prior to patients arriving at the hospital. So it's kind of an incredible thing to think about the number of avenues where people will get information in a crisis situation. You just have to be familiar and acquainted enough with various platforms and being able to monitor those and having enough people to assist you in that capacity.
So I would imagine that a trauma center like Renown would have, you would sit down and you would kind of talk about mass casualty accidents and how are we going to do this? And then you would work with maybe people from REMSA or the fire department or the police department. Is that how you guys crafted a plan like this?
Yeah, and that's something that in that sort of industry you practice and plan for. I think we did probably 2 or 3 drills, either tabletop exercises or live action type exercises, maybe once every 2 years. But we it's a cooperative effort with first responders, REMSA, police, fire, all those agencies get together and we practice and run through different scenarios. So it's definitely something that you have to do. And as far as emergency management, and most emergency managers are acquainted with that process.
And you have a dedicated person who is crafting messaging for your organization as it comes in?
I'm sorry.
So as information updates become available, is there a committee? Is there someone specifically designated to craft that message to go out to the public?
Yeah, if you've sat in on a incident command center, you have various individuals that are at the table. You know, you're the incident commander. You have somebody who's managing communications. You know, the PIO to facilities. You know, what sort of resources we have. And so everybody's kind of weighing in, and you kind of decide at that point, okay, this is the information. And as a PIO, you make recommendations. This is what I think we need to tell, you know, this is the type of information that we can provide and, you know, not stand at risk from privacy or anything of that nature. So it's basically kind of volunteered from the PIO and approved by that governing board, the Incident Command Center. So,
And then at some point you have to determine, as these messages are coming in from various platforms, which is real and which is not.
Yeah, I mean, everything that we send out is going to be real and accurate, whether it be patient condition updates or this is the total number of patients we've received. This is their conditions, whatever. That's kind of the situation. You have to look at the information, and you can kind of gauge what sort of information the news media wants by just having conversations with them. Not during a live interview. They're going to be asking, "Hey, this is what my manager's asking me for. This is the type of information we need," and knowing your background, what you can and cannot tell in that given situation will help. And then you can parlay that at the table with the incident command saying, okay, this is what the news is wanting. What sort of information are we willing to give? And are we able to give is probably a better way to put it.
And information that and you have, not what is maybe external to you that's coming to you.
Correct. And that's where monitoring various outlets and platforms is beneficial, because the rumor mill is probably the most difficult thing to manage at that time, because people just don't know. And so they hear one thing, or somebody thinks, oh, I think this is what happened, and that's how rumors start. And whether it's accurate, semi-accurate, or completely false, you have to address each of those and dispel any of those rumors as quickly as you can.
Can you paint us a picture of what it's like to just walk in on a situation like that, almost the day of, or give us your day in that situation? You talk a lot about being prepared for it and getting ready for it, but how was your experience walking into a true crisis?
Fortunately, in healthcare, you deal with professionals who deal with a crisis on a daily basis. Any ER nurse or manager or doctor deals with those crises on a daily basis, and so it's almost relieving to step into a group of professionals who are acquainted with that, and reassuring at the same time. I can't say that other industries are as comfortable in a crisis like that, but you definitely have to. It's nice to step in and see somebody who's even keeled and is not going to be swayed one way or another emotionally in a situation like that. And I think that's just where professionalism comes in, and just having a level head and taking a deep breath. And one thing I noticed in a lot of the trainings we did prior to this sort of incident is just self-care. Just talking to the various people on the incident command board. How are you doing? When's the last time you ate something? Or, do you need a drink? Or, just that self-care, or just concern for your own members of the team to make sure that they're managing things well enough, I think is helpful and beneficial.
What would you say to anybody looking to get involved in a position in specifically crisis communications? There's a lot of students out there that are tailoring their studies just towards crisis. And do you think that there's a lot of longevity in that? Do you think that you had a career in it, but how long do you think you could have lasted doing that day in and day out?
I wouldn't say, what defines a crisis? That's the biggest question. I mean, what may be a crisis for one person may not be a crisis for another. If you've lived in a newsroom or pretty much every day is a crisis, because you're trying to find that story before the day's out. You're trying to build. If you've worked in a taxing job that takes a lot of your know all and be all, I think you're essentially living in a crisis day to day. And if you're a good professional, you learn how to work through those challenges and work through those crises. I don't know if that's. I'm trying to think. The question you asked, how.
How would somebody who's never done this before really approach a career like this, saying that I haven't done crisis before? It's not I haven't had to deal with a situation such as a Reno Air Races level event, but that's what I want it to be my career. I know that I want to head in that direction. What are some tools that you would say that students need to acquire these to really be successful in this industry?
Gotcha. First off, I would say that's nothing that I ever want to aspire to as far as, I seek out crises. In terms of preparing, though, I think just having that background and experience. I mean, nothing will ever really prepare you for the real thing, but the more practice you can do, tabletop exercises are extremely beneficial, and it's almost like that muscle memory is for athletes. If you've done it enough times on paper and pencil on a tabletop, that's the way you're going to perform during a real crisis. Is just having that mental muscle memory of things and following the steps. I think that's where a lot of failure happens in a crisis, is they fail to follow the plan that they've prepared. And if you have a sound plan prepared and approved from your CEO or wherever your governing bodies are or will be, and you follow the plan, then you're going to be safe either way. So,
how critical is it in most industries? I know as a practitioner myself, one of the things I talk to my clients about is we have to have a crisis plan in place. We have to be thinking about what could happen, what could go wrong. And I can tell you that probably 75% of them will tell me, nothing ever goes wrong. We've never had to deal with it. How important is it to PR practitioners to counsel clients on getting a crisis plan together?
I think it's always a challenge because, like you said, everybody's like, oh, that's not going to happen to me, but I think if you can show, a lot of what I do is media monitoring. And, I just read an article today about a school district that had one of their Chromebooks catch fire and explode or cause a school evacuation. So there's situations like that I'm actively monitoring, and I'm throwing out that news story to our chief of technology saying, hey, what would happen if this happened to one of our Chromebooks or one of our students had this laptop that caught fire, So it's a lot of just like putting that information, the what ifs, what if this happened? What if, I monitor a lot of the school shootings and different things, what precautions are we taking if something like this were to happen? And I think just having that conversation with those key people at your organization is what's going to bring about, okay, yeah, we need to plan for this, or this is, and most people are pretty like, okay, yeah, I want to be safe. I want to be forethinking and help avoid some of these situations. So
great advice. Thank you.
Are there any last takeaways that you would want to give somebody who's a practitioner, or just general advice for anybody coming up on a crisis situation?
I would say just be genuine, be who you are, stand tall in those meetings. Like when you're at the table, you're the professional, you're the one that knows everything there is to know about communications, and don't back down. If you have an opinion about something, you make it known to the incident commander or whomever is governing that crisis to, hey, this is what I think is going to be beneficial, and this is why. So be genuine, and just do the best you can with what you've trained for.
You've been listening to Better PR, a podcast by PRSA Sierra Nevada. Thank you for listening.